Hey guys, it's Danielle King. I'm an internal medicine doctor, Dr. King. A lot of you know me. I've grown up with you in church, and we were having a family conversation over Christmas breakfast, and we were talking about the vaccine, and I just said to my family, I said, well, do you want a little lesson about vaccines and trials? And of course, you know, my family, they love me, so they'll listen to me talk anytime, and they said yes. So basically, my dad wanted me to pass this on to you. So this is how I want to explain drug trials and studies and vaccines to you. It doesn't matter what drug we're talking about, whether we're talking about blood pressure medicine, cancer medicine, talking about vaccines, everything has to go through a study. So when you do studies with vaccines, you have phase one, and a phase one trial means that you think that you have a drug or a vaccine that works, and you want to test it to make sure there's no life-threatening effects. Now, this is usually done on about 5 to 10 people. These are the bravest 5 to 10 people you've got. Usually it's people associated with the study. So they feel that it's pretty safe, or they wouldn't do a phase one part, and they give that medication, or as with the vaccines, the vaccine, and they watch these 5 to 10 people to see if they have any life-threatening events, such as heart attack, stroke, death, kidney failure, liver failure. So that's what they're looking at when they do these first phase one. So if a drug gets through phase one, then it moves to phase two. In phase two, we're looking at the small side effects. You know, we know it's not life-threatening. Nothing has shown up. Now we're seeing what other side effects can it cause. Can it cause muscle aches, pains, nausea, diarrhea, headache, fever, chills, things like that. So this study usually is about 200 to 500 people, and you're going to study these patients for a while. Now, if you have a drug that you're looking at, like a cancer drug, like specifically an estrogen, progesterone positive, HER2 negative cancer, that you want to know what the safety of that drug is, you have to find 500 patients that have the exact kind of cancer that you want. And those studies take a long time, because you have to wait and find somebody that fits all of that criteria. Whereas with vaccines, they're for the general public. So you can find 250 to 500 volunteers to do those phase two trials. So in phase two, again, you're looking for side effects. So once they deem that a medication or a vaccine is safe in phase two, then we move to phase three. And phase three looks at, does it work? So now we know it's not life-threatening. We know that the side effects are low or comparable to placebo. Now in phase three, we're going to say, does it work? Because if a medication or a vaccine doesn't work, it's not worth giving. So for phase three trials for a vaccine, it has to be 50% effective. And to me, 50% isn't that good. That's a flip of a coin, but that's the criteria. It at least has to reduce disease by 50%. So, you know, my big thing was with this vaccine, or any vaccine, you know, how effective is it? So with the phase three trials, this is when you get thousands of patients. Normally you have maybe 3,000 patients, sometimes up to 16,000 for a phase three trial. And now you're looking at, does it work? So they'll give patients different dose strengths. They'll look at it over a certain period of time. How much does it reduce infectivity, or how much does it reduce, if it's a blood pressure medicine, your blood pressure, if it's a cancer medicine, your cancer response, by at least half in order to be considered effective. So with the vaccine, of course, you know, one drug company had 30,000 patients in phase three. The other one had 45,000 in phase three. And the reason why they could get so many patients is because it was the general public. If you imagine a chemotherapy drug, you have to find 3,000 patients that fit your criteria. And those studies, that's why sometimes they take a month, 2 years, 5 years, 10 years. It's not because that maybe the drug doesn't work or not. It's because you have to find enough patients to fit that criteria to make that study legit. So with the vaccine study, basically what we're looking at is we have a general population. We have a lot of patients that have taken the drug. So we have a bigger population that we can make sure that we can prove that it's safe and it's effective. So the good news is that we have found that the one vaccine is 94.5% effective, and the other one is 95% effective. And this is pretty amazing results. And we don't, this is awesome. This is actually such advancements in medicine that it's quite amazing. So for me, do I feel that the vaccine is safe? Absolutely. Would I give it to my parents? Absolutely. Would I give it to my children? My child? Absolutely. I know it's safe. Now I even know it's effective, and it's way more effective than 50%. So I feel very comfortable with it. And then, people say, well, how in the world does it work? So just so you know, there's only 4 things in these vaccines: salt, sugar, fat, lipids. That's what binds the mRNA that I'm going to talk about. And then mRNA, and this is messenger RNA. This is what tells the body how to produce the M protein that your body's going to, make antibodies against and kill. So what is mRNA? So another good analogy that we have is mRNA is like a dress pattern, okay? You buy a dress pattern, you put it out. The dress pattern does not make a dress. It requires somebody to take that pattern, follow the instructions, and produce a dress. So the same thing with your body, your cells. So when this vaccine is injected, it's mRNA that's injected in those local cells. And of course, we're dealing with the arm, so it's injected in your arm. And what basically happens is that mRNA goes in there, and there is an organelle in there called a ribosome that is going to look at that mRNA, that pattern, and say, let's make an M protein. And so that M protein is made. That M protein goes to the exterior of that cell, and your body says, hey, wait a minute. We don't recognize this M protein. This is not part of this patient's makeup or DNA. Something is wrong. And so what happens is this stimulates our immune system to go in there with T cells and macrophages and B cells and all the stuff you learn about in pathophysiology and biochemistry. And it comes in and it basically takes out that cell that now has that M protein because your body recognizes that as bad stuff. So when it does that, your body will start making antibodies that will recognize that M protein. So M protein is what is required on coronavirus for it to be able to enter the cell to infect it. Think of it like an automatic handicap door, right? You have to hit the button and the door opens and then you can go inside a room. So with the coronavirus, this M protein is very important for it to be able to enter into the cell that it's going to infect. And so if you are attacking that main key, that main entry, then the coronavirus cannot infect that cell. And so that is the principle behind this vaccine. It is not live virus. It is mRNA that makes a part of the virus that your body will recognize to make antibodies to kill the virus. So we are very excited. Now, I just will let you know that because you are getting a vaccine, your body does have an immune response. So people are going to have some achiness. They might have chills. They might have fever. Your body is going to mount a response showing that your lymph nodes are trying to create, cells that are going to create antibodies to attack this, so that if you ever are exposed to the real thing, your body can attack it and eliminate it before it infects you. So this is my conversation that I had with my family, and I hope I haven't bored you too much. Love you guys. Stay safe.